I'm Randy Alvarez. You're watching The Wellness Hour live here on Facebook. And we're talking about the hottest topic, I think, right now, or at least it's a hot topic for me. Weight loss with Ozempic or Ozempic type of drugs. And with us, we have a pain management physician. He's a regenerative medicine physician. And he has a lot of good things to say about Ozempic. And with us, we have Dr. D. Dr. D, welcome to the program.
Thank you, Randy.
Now, first off, Ozempic, is it safe?
It is
for the right person and the right dosing?
It is absolutely safe. So we besides our pain management practice, we have a concierge practice where we treat people that want to lose weight and want to look beyond, they don't necessarily come in with pain, but they want to look beyond their health, and they're very progressive about their health. And we have a lot of patients. We've been treating people with semaglutide, which is the generic term for Ozempic, for about 10 years now.
Semaglutide.
Semaglutide is the Ozempic. Tirzepatide is the Mounjaro, right?
Okay.
So they're both, peptides. And these people, I don't think people realize that these have been available for years, right?
They really work.
They really work. We've been treating people for probably 10 years, right? When these brand name drugs came on, obviously there has been a little bit of a backlash against compounding pharmacies but they still make these generic drugs. So, for people who actually cannot afford the full price of medication, there is, the possibility of having these medications from generic pharmacies. But back to your question, do they work? Yes, they work. Do they have side effects? Of course they have some side effects, especially, in my opinion, Ozempic probably a bit more side effects than Mounjaro, but obviously it's individual dependent. Now, I see almost one article every day, and I don't read the whole press, about the side effects. I mean, there was something in, I don't remember the publication, about people who took Ozempic or Mounjaro, I don't know what it was, their stomachs are paralyzed, so there's this
I read that article.
Yeah, so it was a couple of days ago, because people send me all these articles now. It's like, look.
I sent you an article about Weight Watchers
Weight Watchers on Ozempic, exactly, but your stomachs are paralyzed, people cannot
That's very
take
rare.
it. It's rare. I mean, nobody's going to talk about, out of 1 million people, 5 or 10 of them had nausea, because that doesn't generate any clicks, right? But if you put stomach paralysis in the title of your article, oh my God, these are, so I think there's a lot of sensationalism about the side effects. I mean, every drug known to men is going to have side effects. Is it going to be for 100% of the people? Absolutely not. But
Look, I know 3 people, at least 4 people that are taking this, and they say they don't really have nausea, but they have no appetite.
Yeah,
and they have to be careful they're worried about not eating.
Well,
like for some people that have big appetites, it's wiped out.
Yeah, it is. And like the more you take it, some of the appetite comes back, right? So this is, obviously it's, at first, your system, needs some time to adapt to the medication. For instance, I've taken these medications for...
You take it?
Yeah, for several months, maybe longer than that.
More than about a year?
Yeah, probably a year and a half, maybe.
I have to put this in context because we're doing a Facebook Live on this.
Right.
The first time I met you, walk in the studio, you're like, 50 plus.
Yeah.
Biceps are bulging, lots of muscle.
Yeah.
I mean, you're ripped. I mean, you're in world-class condition.
Right.
And I've had doctors say, but the problem is you lose all your muscle. You haven't lost your muscle, but your biceps are bulging.
Well, you lose all your muscle if you don't do anything to preserve your muscle, right?
Okay.
But there are mitigating, things that you can do not to lose your muscle,
but why
right?
keep taking it, by the way? I'm sorry to interrupt, but why keep taking it if you're already in great shape?
It's a good question. I think, I don't know how to answer that question. I mean, I take it because I feel good, and it just, all my labs look great, and I know that there are some long-term side effects. I mean, long-term effects, not side effects, to this medication that we are still not fully aware of. And I'm talking about cardiovascular benefit. It decreases cardiovascular events. I'm talking about Alzheimer's prevention. I'm talking about memory. I'm talking about a lot of things that are not yet on the radar for most people. And if you see these preliminary studies that are done right now, and with all these, right, then you're going to be wanting to take it too.
So can you be 20 pounds overweight, 15 pounds overweight? Because that's the challenge. Most people, they can't lose that last 15 pounds.
Yes,
Is this excellent for those people?
It's excellent and it's safe and it can be used as a jump start to a better lifestyle, right? So you can take this medication for as long as you need to take it to get to your ideal body weight, and then get off of it, and then maintain the type of lifestyle that you need to maintain to remain at that body composition. Nobody's gonna tell you to take it forever, right? I mean, there are some of us who are maybe a little, they know a little bit more and take it for different reasons, but clearly for that kind of person, it's fantastic.
As you know, we've talked about this. I've been studying nutritionists as like a nutrition
you did tell me
for more
about
than
that,
30 years. And it always frustrates me that a lot of the skinny doctors, and I've had them on my show, I go, you've never had a weight problem in your life and you're telling us how to lose weight.
That's right.
You've never had to lose weight. Or they'll talk about fasting. Well, if you're hungry, good luck trying to fast.
Right.
And then, of course, every animal study, rat study, all the animal studies say if you eat 30% less, you're going to live longer. All the longevity books.
Absolutely.
So I'm interviewing anti-aging medicine physicians that are saying, Randy, Ozempic could get you there.
Exactly.
That means you can eat 30% less and you're going to feel better. And then there's a whole thing about insulin sensitivity. It makes your metabolism better.
Absolutely.
Is there truth to that?
Yes, your metabolism. And if you think of Alzheimer's disease, it's type 3 diabetes, right, which is an insulin issue, and other things like polycystic, ovarian syndrome and other things that are insulin problems, the ramification of these medications are still unknown, and it could work for a lot of things. But just to get back to your point, look, we can be dogmatic about this, right? And doctors in general, are pretty dogmatic. There's very few that are actually, are evolving. It's generally what we learn in medical school, what we learn in fellowship, what we learn in training, and this is what we do, right? So we can be dogmatic about this and say, well, the only way to do this is diet and exercise. I spent the first 15 years of my career telling all my pain patients, diet and exercise. And you know how many did it? 0, right? Now, you can be practical and say, look, we have this medication. It doesn't seem to be causing, any side effects. It doesn't seem to be, the people. It's well tolerated by the vast majority of people. Why not use it? Well, price might be an issue, right? But again, this is what I was telling you about the compounding pharmacies, because people can get it at a lower price from compounding pharmacies. So if the price is reasonable, right, and we have this medication that gets people into the lifestyle and the body composition that they like to be in, well, what are you going to do with that? You're going to avoid diabetes. You're going to avoid cardiovascular disease. You're going to avoid stroke. You're going to avoid myocardial infarction. How much does a heart attack cost?
Yeah, it's
right?
expensive.
When you have a heart attack, right? You're in an emergency room. How much does that cost you, right? How much does that cost the system versus $400 a month for Ozempic, right? Or tirzepatide or whatever.
Here
right?
in California, it's over $1,000. You're saying you could do for people watching this on Facebook Live, you could do a telemedicine consult, maybe like $450 to start, telemedicine, like on Zoom.
Yes.
A secured Zoom, you have a special Zoom?
Yeah, absolutely, HIPAA compatible,
And then they could buy Ozempic for about $500 a month.
Yes, absolutely. Absolutely.
And,
yes. Obviously all these pharmacies are, they're trying to keep up with the demand, so they may have to wait a week or two up front. But yes, absolutely.
I had a doctor, his wife is taking it. I have another doctor, her husband is taking it. I was thinking a lot of physicians, spouses, are shrinking. Because they're in the know and they're getting it.
Physician spouses.
Have you noticed this?
Not only that, but I've noticed movie stars shrinking it. I don't know if you've seen. I've seen a thing on TV.
The Housewives.
It was Tom Hanks was on TV recently. I think it was on CBS Sunday Morning, and he looked like half of Tom Hanks, right? I was like, he's on Ozempic.
But look, and then there are. Do you think it's insensitive? I don't want to put words in your mouth, but do you think it's insensitive for a doctor who just says, look, you don't want Ozempic, just do diet and exercise?
Absolutely. I think it's dogmatic and I think it's impractical. And I think that if you can get your patient to where you need to get your patient by using a medication that's relatively safe, that's fine. You're asking me why you don't get off of it. Like people high blood pressure, we don't tell people with high blood pressure to get off of medication, right? If you have blood pressure, you take your high blood pressure. If you have diabetes, we don't tell people, get off the medication right now, right? So it's almost like, okay, if it helps, and if it helps you avoid bigger, worse problems, okay, take it.
Here's the thing. From a guy that's been on a diet since he was about 15 years old, that's me,
right?
We all know, like lean proteins, low glycemic vegetables, plant-based diet.
Yes.
You know, I see books with vegetables.
Right.
But that doesn't satisfy most people. Everybody knows that.
It doesn't.
So you're saying that Ozempic, in your experience, even treating patients, that allows them to be satisfied by vegetables and
exactly
and
right, and cuts your cravings. You know, and there have been some interesting studies in people, alcoholics, or people who take drugs, you know, so if it cuts your cravings, right? So it may help even people with addiction problems.
So not only does it work with insulin sensitivity, helps with type 2 diabetes, but without going deep into this, it's doing something to the brain.
Absolutely.
That's making you feel satisfied.
Yes, these GLP-1 receptors are not only on the bowel and on the pancreas and all that, but they're in the brain, on the heart, and you know, a lot of other tissues in the body. And we are just now starting to understand how these medications work on all the other tissues. But yes, as far as the brain is concerned, yes, it binds to these receptors on the brain, and it gives you what's called an anhedonic response, meaning you don't take pleasure into eating, drinking, taking drugs, whatever, right? By the way, it preserves all the other.
I need to do this. Everybody needs to do it because everybody wants to lose 5, 8, 10 pounds.
Look, right? I mean, I'm not telling this should be, this should be your number one choice. I think, but I think that if someone like you, right, who's tried everything else, you've been really
try to
good,
eat very clean.
Absolutely, and you do, and you probably need to eat a little dirtier, actually, because you don't need.
I'm afraid of bread, gluten, dairy, soy.
I know we're working on that with you a little bit, but but what I'm saying, is like, let people, don't tout this as a first line treatment, right? But in people who have tried everything else, right, then let them take it. We know now, I mean, there's lots of obesity research now, right? So we know that is a question of leptin and ghrelin and all these other things. It's not as simple. I mean, look, I was the guy who said, well, you're eating too much, right? You're fat because you're eating too much, right? I mean, I was the dogmatic guy, and then I realized, it's more, because I started reading and I started talking to people, and there were people who really eat clean who are overweight, right? And, then I realized...
So some people hold on to fat better
absolutely,
than others.
and there's genetic things, and there are things that we don't even know. And if this medication helps, they're going to have an oral medication, pretty soon, or several oral medications.
I know somebody personally, they go, Randy, they were trying to tell me, normally I would get... I had 3 tacos, rice, and beans.
Yeah.
Now, I could barely eat that one taco.
Right.
Now, fen-phen, I was around during fen-phen 25 years ago, but it made people jittery.
Oh,
they felt
cardiovascular.
Weird. Do you get that with Ozempic? Because
no.
I've talked to friends, they say, I don't want to feel jittery.
No.
So there's no stimulant effect.
No, there's no stimulant effect. Again, nausea, vomiting, diarrhea, constipation, it's intestinal, gastrointestinal side effects are basically the side effects for this, right? Most of them are mitigated if you take it as prescribed,
So
which means
small,
you start at a very low dose and then you let your body adapt to it.
You find your dose.
Find your dose. And once you hit your dose, don't go, more is not better, right? You found your dose, you're losing weight, you're achieving your goals.
It lasts for 7 days.
Yes.
Like you take a little tiny injection. It doesn't hurt.
Once a week. And like I said, they're going to have more and more oral. There's some oral drugs on the pipeline, so there's going to be a daily oral medication very soon.
Now, I got to tell you something. Sometimes we all could be jealous. I would see people when Ozempic first came on the scene and say, oh, well, they just used Ozempic like they were cheating.
Right. Well,
and now my mind has changed. It's like, it's not really cheating. Like, it's the whole thing with anti-aging medicine or biohacking.
Right.
You could either take advantage of what modern medicine offers or not.
Absolutely.
Like open heart surgery. That's not natural, but if you need it, use it. So if Ozempic controls your hunger for the first time in your life,
use it.
So it's not cheating.
I'm going to give you my wife's phone number and you have to call her because she's the one that's like, well, you're cheating. I was like, no, it's not cheating, right? I mean, it's not that I go and gorge myself with fried foods every day, right? I still do everything that I was doing before, but this thing helps me be at a level where I've always wanted to be, right? It's just as simple as that.
Arnold Schwarzenegger, it was one of his books, I was reading this probably after high school, but he was saying, people would say, oh, because of steroids is why he looks that way. He goes, no, I had to eat right.
Yes.
I had to do the right workouts. I had to get the right sleep.
Absolutely.
I had to take the right supplements. Is that the way Ozempic is? That means Ozempic's not going to do all the work.
That's exactly right.
So you have a choice of just, like when Fen came out, a lot of people were just eating a couple of cookies and that's dinner.
That's right.
So if you take advantage of having no appetite for the first time in your life and eat clean, this is like a winner.
It is. You cannot, these are extremists, right? Just like the article with stomach paralysis, right? It's extremist people who say, well, you're taking this so you can cheat. No, nobody, no doctor in his or her right mind is going to tell Randy, take Ozempic and then go and gorge yourself, and drink a bottle of vodka every whatever. Nobody's going to tell you that. Everybody's going to say, hey, do all the other stuff and use this as an adjunctive medication. I read an article,
people are like, that were nail biters, they're less likely to nail bite.
Well, that's what I'm talking about. It's all these other things that we're finding out.
You're like more satisfied across the board?
Right. It cuts your some of these euphoric pleasures that you get from things that you shouldn't get, right? So it works on your pain receptors to cut that.
And they feel better.
So you've
treated hundreds of people on this?
Hundreds of people. In my field, with opioids, right? I mean, again, I don't prescribe opioids, very hardly, but it would have been interesting to have these kind of medications when you get people off the opioids to put them on these medications, see what happens, if it's easier to get off the opioids,
so
right?
The active ingredient is what?
The active ingredient is semaglutide in Ozempic and tirzepatide in Mounjaro, and those are peptides, which are small, short chains of proteins, of amino acids, right? So if it's a long chain of amino acid, that forms a protein. If the chain is shorter, we call that a peptide. For instance, insulin is a peptide, right? So
you like Mounjaro because it's less nausea, less side effects.
In my opinion,
but it's still the same thing. It's just a combination of medications.
It's a combination of. It acts on two receptors versus one receptor for semaglutide. But in my own personal experience and the experience of my patients, I've had better tolerability. What's the word? Tolerable. It's tolerated better, right? Tolerability with tirzepatide versus semaglutide, right? And also in head-to-head studies, the weight loss is better with Mounjaro. So if you
have type 2 diabetes, insurance may cover this.
Absolutely.
And if you don't, for about $500 a month.
Yeah, you can get a compounded. Yeah, you can. I mean, you get a little bottle. You have to inject yourself. I mean, you have to get over the fact that you have to give yourself a little insulin injection, once a week. I mean, it's not really a big deal. Just as diabetics, they do it every day.
When you took it, and when your patients take it, do they notice like a week later, a month later? How soon do they go, oh my goodness, I'm not hungry?
It varies from. The hunger part it's a matter of a week or two.
I had somebody said that morning.
Yeah, they were hungry. I mean, I would say conservatively a week or two. And then, the weight loss, it's amazing. I get emails, I get texts all the time. I've lost 5 pounds, I lost 10 pounds. People have been on it for a month, 6 weeks, It's really pretty unbelievable,
So, look, it's funny. Well, it's not funny, but 60-year-old, 50-plus women, they're taking bioidentical hormones, progesterone, estrogen, testosterone, thyroid, and nobody says, oh, you're cheating.
Exactly, yeah.
Is this in that the same kind of thing where it's like a biohack, it's a cheat?
It is.
And it works on your cravings?
It is absolutely the same kind of thing. It's the people who refuse to take aging and weight gain lying down, right? They're going, okay, I can do something about this. I have a tool now that I can do something about this, and I want to look good, and I want to enjoy my life, and I want this second half of my life, maybe if we're talking about the people on hormone replacement, to be just as good as the first part of my life, And if this helps me get that, with the risks being so low, more power to you.
Now, now people, I guess if they're watching this, especially if it's Facebook Live, they might just be tuning in. But you're a pain management physician by training.
Yes.
You do regenerative therapies, avoiding like fusions and opioids and things like that. I mean, that's what you do.
Yes.
And you're also into longevity medicine.
Absolutely, because I see these people, and people come in with knee pain, and they're 5'4" and they weigh 250 pounds, and what's the point of treating their knee pain with stem cells, when you're not talking about the elephant in the room, which is their weight, right? So the more you ask yourself, why are these people having these problems, the more you realize, I have to help these people in different ways, right? So this is where I have another part, I've established another part of my practice where these people come in and we help them, lose weight. We help them optimize their hormones because ultimately everybody wants to feel better, right?
So legally they could do this in California, for example, with a telemedicine consult.
Yeah, absolutely, yeah.
Do you always have to see blood work?
Well, but generally, it's prudent, right, to have some blood work. Maybe they have some blood work from their primary care physician
for
the
within 6
annual.
months, maybe?
Yes, absolutely. We don't need to go crazy with blood work. Certainly in our hormone replacement people, yes, we do.
You also do hormone replacement
absolutely.
therapy?
Yeah. Well, it's part of the same. Again, like just you said, it's a continuum of things, right? I mean, testosterone is going to help you lose weight, right?
I mean, it
and
almost
lose
sounds
fat.
too good to be true. Is it too good to be true?
Not in my experience.
But it works.
It works great.
Does it work better for people that are in pretty good shape and just have like 30, 40 pounds to lose? Or does it work better for somebody that's really obese?
I mean, it works more dramatically in people who are more obese, obviously, because, they really need it. If you're 5 or 10 pounds overweight, well, you're probably not going to see as much. I mean, when you lose 5 or 10 pounds, if you're already there, it's not going to be a dramatic thing. But the people who are 50 pounds overweight, 60, 100 pounds overweight, I mean, I've seen some, I can tell you stories about patients that just, they're different people, people.
Yeah.
I mean, what can be more satisfying, if you're a physician, than just to see somebody, they come in and they have all these problems, and then you work with them and 6 months later, they're a different person, Like, I don't care. Really, it doesn't really matter how much money you make on this. The satisfaction of seeing those people, it's priceless.
So in a way, it's kind of a detox because you're getting rid of a lot of fat cells, which toxins are stored in fat cells.
Absolutely. And with losing fat, you're losing exactly what you say all the time. Because fat is an endocrine organ. Fat secretes a lot of things, right? We don't realize that fat is not just sitting there like a blob. It's an active endocrine organ. And when you lose fat, you're not just losing your weight and your fat, but you're losing a whole lot of toxins and hormones and everything else that fat secretes. And it's a virtuous cycle at that point.
So nothing to be ashamed of to be
not in my book.
One of these type of medications.
Not in my book. Absolutely not. Absolutely not.
And the cravings are gone. And do you find people have more energy?
Well, obviously.
Because that's what it's all about, is energy,
Exactly.
right? Energy to have fun, to go skiing, whatever.
Absolutely. I mean, hey, you're 40 pounds overweight, and now all of a sudden you're not carrying that 40-pound vest, around anymore. Of course you have more energy, Your knees are not hurting. Your hips are not hurting.
Are you hearing things like better libido, better memory?
It comes with the territory, especially when we do hormones too, libido is a function of how well you look. Your self-esteem, right? I mean, this is probably the most important thing about libido, right? So all these therapies help you gain that self-esteem back, right? And then you're enjoying everything.
Self-confidence.
Yes.
You're back.
Energy, exactly. You can go and start that new company that you already wanted.
Now,
you wanted to do it.
Ozempic face, Ozempic butt. This happens when you lose a lot of weight anyway. Your face sinks in, right?
Okay, right. I mean, if we start looking for little things to criticize Ozempic face. Okay, so what? Your face is not fat anymore, and now you have Ozempic face. Okay, fine. I'll deal with Ozempic face.
Look, as you get older, in the 50s, 60s, if you lose a little bit of weight, you start getting crepey, baggy skin anyway.
Course. And you know what? Would you rather have Ozempic face and be and be fit, or do you want to have a nice plump face and just have a heart attack waiting to happen?
Because you're doing this a lot with patients. So when you see articles about Ozempic face, Ozempic butt, and all these,
it's just so frustrating.
It is?
It's just it's so frustrating because I know it's clickbait, and I'm like, and then I went as far as look at the credentials of some of these people writing the articles. I mean, these people worked at Disney World or something, all these like so-called journalists, They're all like health journalists now. I mean, and I'm like, well, what are your qualifications? And, you look at them and you go like, oh, it's just basically a person hired to generate clicks, right? You know how it works, right?
Look, I read every time there's a Mounjaro, Ozempic, Wegovy, or whatever they're called, article, I can't seem to find anything negative, only like a very few. So I'm thinking all these skinny nutritionists that are writing articles, I'm sure they're bound to start on attack mode.
Right.
Because they feel like it's cheating.
Well, I feel like it's cheating, and it's a direct attack to what they do, right?
That's what a biohack is. It's cheating.
Yeah, but cheating is not. It's not cheating. It's not bad cheating, right? It's good cheating, right? Because there's not all cheating is bad, right?
I had a dentist that told me. I said, well, 400 years ago, nobody flossed and they had pretty good teeth.
Yes, yeah.
He goes, you don't have to floss. He goes, it's like a biohack.
That's right.
It's like it's something you do to kind of for prevention.
Look, Randy, you're getting a hip replacement, right? Is that cheating?
Okay.
Right? You're getting a stent in your heart. Is that cheating? Right? Nobody thinks about that as cheating, right? But what you're doing really is cheating, right? Because there's a reason you have that arthritis, in the hip, and your hip doesn't work anymore. Maybe Mother Nature says you're done, right? So what are you doing? You're cheating, right? You're putting an artificial hip in. You're putting a stent in your heart so you can live another 10 years, right? None of these people say that's cheating, right? I mean, all these procedures that we've done to prolong people's life and make people's life better are not cheating, but somehow Ozempic is cheating, right? Ozempic that will prevent all the hundreds of thousands of dollar, procedures, in the future, right? So it makes no sense to me. I mean, if you really think about it logically, it makes no sense.
But so the goal though is to not just eat that, pizza, like one slice instead of the 4 slices, but to start eating cleaner,
right? And
then exercise.
And exercise. Use this as that motivating factors that you've lacked all these years, right? This is going to get you to a point where you're motivated enough to live like you should, right?
Do you feel like this is like leverage to get them to take action, get them back in the gym?
Look, exactly. You've heard about the continuous glucose monitors, right?
I've worn those, yeah.
Right, exactly. What is that? Is that cheating? We make people wear those monitors and then log what they eat so they can see how their glucose spikes with different foods, right? That's an activity modification, right? How many people have sleep trackers, right?
Yeah.
Is that cheating? No, it's an activity modification device, right? You want to make people aware, right, of what certain things do to them and what the side effects of eating or certain actions, alcohol, whatever, do to them. It's the same with this, right? It's not cheating.
Now let me ask you this, and I'm afraid to even ask you this question because then it's going to make me want to get this tomorrow. But because I'm a little, as you know, I don't eat bread.
Right.
I try not to even white rice or even sweet potatoes and things like that. Is it going to allow a person to have more carbs and still maintain or even still lose their weight?
Absolutely, it's going to allow to have more carbs. And look, if your goal, is certain body composition, if you want to put on muscle and all that, look at all the bodybuilders, they eat carbs, right? I mean, I was just looking at a video, a YouTube post of a bodybuilder. He eats 500 grams of carbs a day, right?
Yeah.
But he works out, he lifts weights. So yes, absolutely, it's going to allow you to eat more carbs. And by the way, that might be beneficial for you, right? That might get you the muscle mass that you need as you get older. Sarcopenia or loss of muscle mass is one of the biggest problems, right? So if you want to put on muscle, yes, eat more carbs. So yeah, all these people, all these detractors who say you lose muscle. Yeah, you lose muscle if you don't do anything. But if you eat protein and carbs and you work out 3 or 4 times a week, but you push and pull some weight, you're not going to lose muscle. And I'm an example of that.
And
I haven't lost muscle.
These anti-aging guys, and I can't speak for guys like Bredesen who wrote The End of Alzheimer's, but he says if you control blood sugar, you control Alzheimer's.
A lot, exactly. Alzheimer's, is one of the things.
Like a type 3 diabetes.
Type 3 diabetes, exactly. Yes. Yeah.
So this is the new big thing.
It's going to be.
It's not going to go anywhere.
I think we're just scratching at the surface. Honestly, I think this drug is going to be probably bigger than anything else so far. We thought Viagra was big, or whatever.
This will be bigger than all of that.
Absolutely. I mean, because it's going to have so many ramifications. I mean, cardiologists are going to start prescribing it. Neurologists are going to start prescribing it. Rheumatologists are going to start prescribing it. It's not just going to be for diabetics anymore.
And here's one. They say, well, here's the problem. This is the naysayers.
Yeah.
You get off of it and you blow right back up.
Yeah, I don't know that that's the case, actually. You'll blow right back up if you go back to the previous lifestyle that you did, which brings me back to, yes, you use this as a platform
to
or as a jump
better habits.
to get in better habits. And once you have the better habits, you're not going to go blow back up.
A lot of people think about food all the time. So this is also a time saver there.
Yes. Well,
I know people eat breakfast and they're already thinking about dinner.
I know. But when I was
fasting, does that go away?
It does, absolutely. There's no cravings anymore. You don't really think about food anymore. I remember when I was fasting, because I did a whole lot of fasting, I realized how much time we spend in a day either thinking about food or eating, and how many commercials on TV are about food. I was fasting. I was in my 10th or 11th or 12th day of a water fast, and I was watching sports, and every other commercial was a burger or something, and I was like, oh my God, So we don't, there are all these subliminal messages around us all the time, with food and, beverages and whatnot.
I like your response. I texted you when I saw that Weight Watchers, this $1 billion company, is going to do Ozempic.
Right.
And I texted you, have you seen this? And you said, and your response was, I guess they figured out that calorie counting doesn't work.
Absolutely. Who wants to do that?
And all the doctors in the know believe, that a calorie is not a calorie.
No,
a calorie
exactly.
from a teaspoon of sugar and a calorie from salmon is different.
Absolutely, yes. This is why the science of obesity is becoming so complicated, right? We can't really just say calories in, calories out. There's that, and then there's an insulin model, and then there's all these other models of obesity.
You've tried a lot of diets. I was surprised to hear in the green room, you tried fasting,
you
tried the one where you have the little maple syrup.
The maple syrup and chili and lemon juice and, Atkins.
So now that you do it, you're just not hungry.
No, I'm not hungry, and I eat.
Eating half amount that you used to? Maybe?
I don't, maybe. I don't even know, because I've been on it such a long time.
You don't even think about it anymore.
No, I don't. I mean, I eat what I need, and I don't think about it. I don't really weigh myself. I'm pretty much the same weight. I look at myself in the mirror, and if I think, there's something going on, maybe I weigh myself, but I don't, it's not an issue for me. It's not an issue for me. I don't think about it anymore.
Because you have a lot of overweight doctors telling their patients, you got to exercise and eat better.
Or trainers, right?
Yeah, so now you can actually do it.
Absolutely. That's also very true. People look at you, and when you look the part, you have more credibility to tell people what to do, right? And it's the same with personal trainers, it's the same with whatever, nutritionists or whatnot, right? I mean, I think there's subliminally, I think people, when they see that you walk the walk, right? They know that you're not just BSing, right? You're basically doing everything that you tell them to do.
Good. Now, this is a Facebook Live, but I want to tell you, you came on the program today to talk about how to get off opioids.
Right.
With some of, how to avoid surgery, infusions, and things like that.
Yeah.
Because of your background. And then I asked your permission. I said, because I know you know a lot about Ozempic. I go, can we talk about this? It's a hot topic.
I love it.
So you will get somebody, if somebody wants to start with you, it's about $450 to start.
Yeah.
They could get it for about $500 a month delivered to them.
Yes.
They do a telemedicine consult.
Yes, absolutely.
And
they have an option of having, of joining our concierge clinic. We have a subscription fee, and we can do more than just Ozempic. But if they just want the Ozempic prescription, certainly we talk about it, and if they're good candidates, sure. I probably will want to look at some labs, and I'll have a conversation about lifestyle. I probably will have everybody do a body composition scan, before they start.
It's so expensive here, though, in California.
What, to a body composition?
No, I'm sorry. It's expensive here to get Ozempic or these type of drugs.
Well,
here.
the pharmacies.
But because you're in Austin, Texas, it's less.
The compounding pharmacies that we use, I don't know, they're in Florida and North Carolina and Houston and all that. They charge the same whether you're in California or in Texas. So it's probably the markup, right?
Look, personal trainers are $500 bucks a month.
I know.
You see them 3 times.
Yeah.
Weight Watchers, Jenny Craig, they're all.
Yeah.
Well, Jenny Craig is no longer there.
Yeah.
But so this is actually cheaper.
I think so. And again, you're just looking at that number, the monthly number. You're not looking at what the money you save by being healthy, right? Again.
Okay.
How much does a stroke cost? How much does a heart attack cost, right? This is what you should be looking at, not that number that you spend every month.
And they're coming out with pills and
oral.
Yes,
it's going to be a lot easier, and you're going to have more and more choices because, of course, everybody's watching this, and Pfizer is watching this, and it's not going to be just Novo Nordisk and Eli Lilly, right, anymore. It's just going to be every pharmaceutical company under the sun is going to have their own version, and hopefully the prices will go down, as we have more choice, if the market works the way it's supposed to. Right,
and can senior citizens, 65, 75 plus, are there any studies showing that you have to be careful as you get older?
No.
Right now, there's nothing like that.
No, not that I'm aware of, right? So, again, I may have not read every study ever done, about this.
So young people, 12-year-olds, 15-year-olds?
So I think I think if I'm not mistaken, 14, 15 is but don't quote me on that, right? I don't think they've done it with people younger than 14 or 15, So, but yes, young people, sadly, right?
I read this all the time. They say muscle burns more fat than having fat, right?
Yes.
That muscle. But then in the bodybuilding community,
right,
there's like bodybuilders, like let's say Dorian Yates.
Yeah.
I remember I was a fan. That's back from my high school days. He was a 300-pound, 6% body fat, 3% body fat bodybuilder. And in his off season, he was a big fat guy.
Yes. Yeah.
So the muscle,
right,
then not on everybody plays a role. I mean, some people just hold on to fat better than others.
Absolutely.
Do you believe that?
Absolutely. Yes, I believe it too. Absolutely.
I think it's insensitive to say, they're just lazy and lack of discipline.
Well, again, mea culpa, that was me, right? I changed my tune. Once you start looking at things a little differently, and once you start reading literature and going back to medical school, because that's what, for me, was going back to medical school, find out about these things. I mean, I was doing spine injections, right? Which I still do, by the way, but you really change your tune and you realize things are a little more complicated, or a lot more complicated than you think they are, and don't be so quick to judge, right?
Okay, good. All right. Dr. D, I want to thank you for coming on the program.
Thank you, Randy.
And
thanks for having me.
I'm excited about it. I probably am going to have to do it. I'll look like a skeleton. I'll get an Ozempic face.
We'll get you there.
I'll get all that stuff. Anyway, thanks again.
You're welcome.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.